as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure. Good day, listeners. Welcome back to DDM Pulse News Updates on our program. Your health, your wealth. I have to remind you guys to subscribe to our YouTube channel, that is Diaspora Digital Media, so you get the latest on health and know how to keep fit. Well, what we have today? Around 1.3 million people die from secondhand smoke every year, according to a World Health Organization report on the global tobacco epidemic 2025. You can imagine. The report released at the World Conference on Tobacco Control in Dublin warned that action is needed to maintain and accelerate progress in tobacco control as rising industries interference challenges tobacco policies and control efforts. Yes. Well, the report focuses on the 6 proven WHO-empowered tobacco control measures to reduce tobacco use, which claims over 7 million lives a year. 7 good million. How many are we remaining this time around? If we should lose around 7 million people, you can imagine. Please, your health is your wealth. Yes, the WHO Empower encompasses monitoring tobacco use and prevention policies, protecting people from tobacco smoke with smoke-free air legislation, and offering help to quit tobacco use. Yes, it is needed to be quit, because if not, we keep on losing lives each year. We might be wondering what the problem is, but the cure is in our hands. It also ensures warning about the dangers of tobacco with pack levels and mass media, enforcing bans on tobacco advertising, promotion and sponsorship, and raising taxes on tobacco. All these things are necessary. In fact, a report read around 1.3 million people die from secondhand tobacco smoke every year. Today, 79 countries from implemented comprehensive smoke-free environments, covering 1/3 of the world's population. You can imagine, since 2022, 6 additional countries like Cook Island, Indonesia, Malaysia, Sierra Leone, and so many other countries have adopted strong smoke-free laws, despite industry resistance, particularly in hospitals and venues. But the question remains, is Nigeria among these countries? That's the question to be asked. Are we among them, or are they just being said, but yet not done? These are the questions we have to ask ourselves. Yeah, it says since 2007, 155 countries have implemented at least one of the WHO, that is World Health Organization, empowered tobacco control measures to reduce tobacco use at the best practice level. It is necessary. It's necessary here in Nigeria. Yes. Today, over 6.1 billion people, that is 3/4 of the world's population, 6.1 billion, not even million, but billion, are protected by at least one such policy, compared to just 1 billion in 2007. Now it is 6.1 billion. 4 countries has even implemented the full Empower package. Countries like Brazil, Mauritius, Netherlands, and Turkey, and so many other countries. 7 countries are just one measure away from achieving the full implementation of the Empower package, signifying the highest level of tobacco control, including Ethiopia, Ireland, Jordan, Mexico, New Zealand, Spain, and so many other countries too. However, there are major gaps as 40 countries still have no Empower measures at the best practice level, and more than 30 countries allow cigarettes sold without mandatory health warning. And Nigeria is part of this country. Yeah, okay, Let me just ask this question. For instance, you are a smoker and you go to about 5 to 6 shops without seeing the cigarettes in order to smoke. Will the person continue being addicted to it? It's a question we have to reason. Two, whereby shops are not banned of selling cigarettes. Why would the addicted people not continue taking it? That's the question there. Sure, because 20 years since the adoption of the WHO Framework Convention on Tobacco Control, we have many successes to celebrate. But the tobacco industry continues to evolve, and so must we. Yes, even the WHO Director General, Dr. Detrus Ghebreyesus, said so, that we have to work evolve. We must. Not that we have to, but we must. Yes, we must. That is the fact there. By uniting science, policy, and political will, we can create a world where tobacco no longer claims life or damages economics or even steals future, because it steals people's future. You can imagine someone dying at the age of 15 only because he's addicted to smokes. Together, we can end the tobacco epidemic. I think so. We can. The WHO Global Tobacco Epidemic 2025 report, developed with support from Bloomberg Philanthropies, was launched during the 2025 Bloomberg Philanthropies Award for Global Tobacco Control. The award celebrated several government and non-governmental organizations making progress to reduce tobacco use. Please, we want you to participate in this. Since Bloomberg Philanthropies started supporting global tobacco control efforts in 2007, there has been a sea change in the way countries prevent tobacco use, but there is still a long way to go. Yay! In fact, the founder of Bloomberg LP and Bloomberg Philanthropies, and even the WHO Global Ambassador for Non-Communicable Diseases and Injuries, that is Michael Bloomberg, said that we all have to work together in order to achieve this beautiful aim. It will be a very good achievement here in Nigeria. But the fact that other countries have stopped that, why would Nigeria do? Sure. The WHO Global Tobacco Epidemic 2025 report reveals that the most striking gains have been in graphic health warnings. One of the key measures under the WHO Framework Convention on Tobacco Control that make the harms of tobacco impossible to ignore. WHO warned, however, that enforcement was inconsistent and smoked tobacco packaging remained poorly regulated. The new report is accompanied by a new data portal that tracks country-by-country progress between 2007 and 2025. In fact, a total of 110 countries are reported to have failed to run anti-tobacco campaigns since 2022. You can imagine. However, 36% of the global population is said to now live in countries that have run best practice campaign, up to from just 19% since 2022. The WHO urged countries to invest in message-tested and evaluated campaign, just as we are doing now. It's noted that over 60 countries still lack any regulation. Yes, I keep on repeating that Nigeria is one of them. But just as you're listening to our news this very hour, think, what are the way forward am I to contribute in order to end the use of tobacco? It's not as if it's a good thing. It claims a lot of lives. Yes, governments must act boldly to close remaining gaps. These gaps remaining, it must be closed. Yes, they have to strengthen enforcement and invest in the proven tools that save lives. Sure, these are the things that need to be done. Not just government, you also is involved. Yes, you are. As you're watching me, you are involved. If you do sell tobacco, if you do sell cigarette, you have to stop them so that those who smoke will at least reduce, even if they are addicted to it, they can reduce that. Of course, we want the best for our siblings here in Nigeria. We are one. No matter which country, sorry, no matter which states or local governments, we are one. We are siblings. Yes, the WHO calls on all countries to accelerate progress on empower and ensure that no one is left behind in the fight against tobacco. Of course, nobody should be left behind. WHO's Director of Health Promotion, Dr. Rudiger Kretsch, also said that we should put hands together in order to make a better country. With this, we come to the conclusion of our news on your health, your wealth. Remember, your health matters to us. We don't want to lose our young ones. If you can even see, if for instance you've gone to neuropsychiatric hospital, you can imagine young men, when I mean young, fit and sound, misbehaving, being unchained because they are being addicted to tobaccos, cigarettes, and cocaine. All these are harmful to our brain. They are very, very harmful to our brain. Yes, they are. So please stay away from that. Your health matters. Your health depends your future. Your health depends your life. Your health is everything. Your health is your wealth. Because if you're not healthy, you can't be wealthy. Yes. So please, don't forget, if you're addicted, please reduce hand. Stop entirely. Please do so. This will come to the conclusion on your health, your wealth. Don't forget to click on the like button, share, comment, and subscribe to our YouTube channel. That's it. Diaspora Digital Media. So you get the latest on health, just as I have given you this little. So please, don't forget to like. Until I come your way next time, I am Inyenyere Michael Inezini. Do have a lovely day. Thanks for watching. Bye for now. Medications as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure, drug